I am Doctor. Today we're going to talk about a topic that many men find uncomfortable, yet it is one of the most critical aspects of your health after the age of 60. We are talking about the prostate, a small gland that can dictate the entire quality of your life. For many of you, the night has become a cycle of interrupted sleep. You wake up at 2 a.m., then again at 4 a.m., struggling with urgency and a sense that your body is no longer under your control. You might think this is just a normal part of aging, a tax you pay for getting older. But I am here to tell you that it is not normal, and more importantly, it is not inevitable. The statistics are staggering. Over 50% of men over the age of 60 show signs of an enlarged prostate, and that number climbs to 90% by the age of 80. But the real tragedy isn't the condition itself. It is the silence that surrounds it. Men wait until they are in a state of crisis, until they experience complete urinary retention or severe pain before they seek help. Today, I am breaking that silence. In this comprehensive 100-minute masterclass, I am going to reveal 5 daily habits that act as a shield for your prostate health. These are not complicated medical procedures. These are simple science-backed lifestyle shifts that you can start tonight. We will discuss everything from the specific nutrients that act like natural anti-inflammatories for your pelvic floor to a drinking schedule that will finally allow you to sleep through the night. I am even going to reveal a specific habit, habit number 3, that most of my patients find completely counterintuitive, yet it is often the most effective tool in their arsenal. If you are waking up more than 2 times a night, or if you have noticed that your energy levels are crashing during the day because of poor sleep, you cannot afford to skip a single minute of this video. We are moving beyond the surface level advice. I am going to explain the physiology of what is happening inside your body, why your symptoms tend to worsen when the sun goes down, and how you can take back control without jumping straight to surgery or heavy medications. Before we proceed, a necessary reminder. I am a doctor, but I am not your personal doctor. The information provided here is for educational purposes. You must consult with your local urologist before changing your treatment plan. Our goal is to empower you with the knowledge so that when you do see your doctor, you are asking the right questions. We are fighting for your quality of life, for your sleep, and for your long-term health. Let us begin by understanding the small gland that is causing so much trouble. To fix a problem, you must first understand the mechanics behind it. As doctor, I want to take you inside the male anatomy to see what is actually happening after the age of 60. The prostate is a walnut-sized gland located just below the bladder, and it surrounds the urethra, the tube that carries urine out of your body. Because of its location, even a small amount of swelling or growth has a direct mechanical impact on your ability to function. As you age, your body undergoes a massive hormonal shift. While your total testosterone may decline, the way your body processes that testosterone changes. An enzyme called 5-alpha reductase begins to convert testosterone into a much more potent hormone called dihydrotestosterone, or DHT. DHT is the primary driver of prostate cell growth. This leads to a condition we call benign prostatic hyperplasia, or BPH. Think of it like this: the prostate is growing in a confined space. As it expands, it begins to squeeze the urethra like a hand tightening around a garden hose. This is why you experience a weak stream and difficulty starting, but it is not just about size. Inflammation, or prostatitis, plays a massive role as well. Chronic low-grade inflammation caused by diet, stress, and a sedentary lifestyle can cause the prostate to become sensitive and painful. Then there is the concern that every man over 60 carries in the back of his mind: prostate cancer. While BPH is not cancer, the symptoms can often overlap, which is why monitoring and prevention are so vital. Why do these symptoms seem to explode at night? When you lie down, the fluid that has accumulated in your legs during the day begins to redistribute into your bloodstream. Your kidneys then work to filter this fluid, filling your bladder more quickly. Combine this with an enlarged prostate that prevents the bladder from emptying completely, and you have a recipe for constant nighttime awakenings. Most men believe they just have a small bladder. In reality, they have a bladder that is never truly empty because the gatekeeper, the prostate, is blocked. Understanding this physiology is the first step toward reversal. You are not a victim of a broken body. You are dealing with a biological system that is reacting to hormonal and inflammatory triggers. In the next sections, we are going to address these triggers one by one. We are going to talk about how to inhibit that DHT surge, how to flush out inflammation, and how to retrain your bladder to function like it did 20 years ago. The inevitability of prostate trouble is a myth. The reality is that with the right habits, you can maintain a healthy functioning system well into your 80s and 90s. As doctor, I want you to pay close attention to the way your body communicates with you. The prostate doesn't usually cause sharp, sudden pain until it is in a state of crisis. Instead, it speaks in whispers, subtle changes that most men dismiss as just a part of aging. But these whispers are early warning signals of a system under pressure. The first signal is hesitancy. Do you find yourself standing at the toilet for 10 or 20 seconds before the flow actually begins? This is a sign that the prostate has narrowed the urethra to the point where your bladder muscles have to work overtime just to create enough pressure to overcome the blockage. If you are pushing or straining, you are putting a massive load on your pelvic floor. The second signal is a weak or interrupted stream. If your flow has lost its arc and looks more like a slow trickle, or if it stops and starts several times, the mechanical obstruction is significant. This is often accompanied by terminal dribbling, where you feel finished but your body continues to leak small amounts of urine. This happens because the bladder is exhausted and cannot perform a clean final contraction. The third signal is frequency and urgency, especially the feeling that you need to go again just 30 minutes after you finished. This is often caused by incomplete emptying. Since your bladder is always 40 or 50% full, it takes very little time to reach its limit again. This constant state of fullness leads to irritative symptoms where the bladder lining becomes hypersensitive. Finally, we must talk about the mental fatigue factor. If you are waking up 3 times a night, you are never reaching the deep REM sleep required for cognitive recovery. If you find yourself more irritable, forgetful, or physically weak during the day, your prostate is the thief stealing your vitality. I want you to take a moment and count how many of these signals you have experienced in the last week. If you have even 2 of them, your prostate is already in the danger zone, and the habits we are about to discuss are no longer optional. They are essential. Now, we begin with our first and most important daily habit, the Prostate Shield Breakfast. As doctor, I often see men who eat healthy breakfasts that are actually fueling prostate growth. To protect your prostate after age 60, you must realize that every bite you take either feeds inflammation or fights it. The secret to a prostate-safe morning is the management of insulin. Insulin is a powerful growth hormone. When you eat a breakfast high in refined sugars, white bread, or processed cereals, your insulin levels skyrocket. High insulin levels have been directly linked to the enlargement of the prostate because insulin signals cells to divide and grow. To reverse this, your breakfast must be focused on anti-proliferative nutrients. The superstar of your morning should be lycopene. Lycopene is a powerful antioxidant that has a unique affinity for prostate tissue. It helps neutralize free radicals that cause cellular damage and mutations. But here is the clinical secret. Raw tomatoes are not enough. Lycopene is much more bioavailable when it is heated and paired with a healthy fat. I recommend starting your day with cooked tomatoes or a high-quality organic tomato sauce soaked with a teaspoon of extra virgin olive oil. This combination allows your body to absorb up to 4 times more lycopene than eating raw slices. Next, we must include zinc and omega-3 fatty acids. The prostate has the highest concentration of zinc of any organ in the male body. Zinc is essential for regulating the 5-alpha reductase enzyme that converts testosterone into the dangerous DHT. Adding a handful of pumpkin seeds, which are rich in zinc, to your morning routine is a simple but potent intervention. Pair this with walnuts or ground flax seeds to provide the omega-3s that reduce chronic pelvic inflammation. A perfect prostate shield breakfast might look like this: 2 poached eggs rich in choline for brain health, served with a side of tomatoes simmered in olive oil, topped with pumpkin seeds, and a side of steamed broccoli. Broccoli and other cruciferous vegetables contain sulforaphane, which helps the liver detoxify excess estrogens that can also contribute to prostate swelling. By changing just this one meal, you are lowering your systemic inflammation and telling your prostate cells to stop their aggressive growth. This is how we begin the process of internal healing. As doctor, I want to address a physical reality that many men over the age of 60 neglect: the impact of gravity and inactivity on your pelvic floor. If you spend 6 to 8 hours a day sitting, whether it is in an office chair, in your car, or on the sofa, you are effectively strangling the blood supply to your prostate. This creates what we call pelvic congestion syndrome. When blood cannot circulate freely, waste products and inflammatory cytokines accumulate in the prostate tissue, leading to swelling and pain. Habit number 2 is the 20-minute daily movement routine specifically designed for pelvic health. This is not about lifting heavy weights or running marathons. In fact, excessive high-impact exercise can sometimes irritate the bladder. We are focusing on functional vascularity. The goal is to act as a manual pump for your circulatory system. The most powerful movement you can perform is the vascular walk. This is a brisk 15-minute walk where you consciously focus on your stride and pelvic alignment. As you walk, the movement of your hip flexors and glutes massages the internal pelvic area, encouraging the lymphatic system to drain excess fluid away from the prostate. If you cannot go outside, you can achieve a similar effect with dynamic squats, slow controlled movements that do not go all the way down, but keep the muscles engaged. We must also discuss the role of the pelvic floor relaxation. Many men suffer from a hypertonic pelvic floor, meaning their muscles are constantly clenched due to stress or pain. This clenching restricts the urethra even further. I recommend 5 minutes of deep diaphragmatic breathing combined with gentle stretching of the adductor muscles, the inner thighs. When you relax these muscles, you allow the blood vessels to dilate, bringing fresh oxygen and nutrients to the prostate cells. Think of your prostate as a sponge. When you sit, you are squeezing that sponge dry. When you move, you allow the sponge to soak up fresh, healing blood. Clinical studies show that men who walk just 3 hours a week have a 30% lower risk of their BPH symptoms progressing to a point where surgery is required. This 20 daily investment is your insurance policy against a stagnant, inflamed pelvic environment. You do not need a gym membership. You simply need the discipline to stop sitting and start flowing. Now we come to habit number 3, which is perhaps the most misunderstood aspect of prostate health, the strategic hydration protocol. Most of my patients tell me the same thing. Doctor, I stopped drinking water after 400 p.m. so I wouldn't have to wake up at night. As doctor, I'm here to tell you that this approach often backfires. When you severely restrict your water intake, your urine becomes highly concentrated. This concentrated urine is acidic and contains a high density of waste products that act as an irritant to the lining of your bladder. This irritation triggers a response. Your bladder feels full even when it only contains a few ounces of fluid because it wants to flush out the irritating acid. This is why you feel a desperate urge to go only to find that very little comes out. The goal of habit number 3 is to volume load in the morning and taper in the evening. You should consume 70% of your total daily water intake before 2 p.m. This ensures that your kidneys have ample time to process the fluid and your bladder is thoroughly flushed of irritants during your active hours. By the time 6 p.m. arrives, your body is fully hydrated and you can reduce your intake to small sips. We must also identify the bladder saboteurs. Caffeine and alcohol are the 2 biggest enemies of a man over 60. Caffeine is a powerful diuretic, but it also increases the sensitivity of the bladder's detrusor muscle, making it twitchy and overactive. Alcohol, even a single glass of wine, suppresses the antidiuretic hormone in your brain. This tells your kidneys to dump all available water into the bladder, which is exactly what you do not want at 11 p.m. Instead of plain water in the evening, I recommend small amounts of pumpkin seed oil or a weak hibiscus tea, which has mild anti-inflammatory properties for the urinary tract. The timing of your hydration is a science. By keeping your urine dilute during the day and tapering correctly at night, you provide the prostate and bladder with a stable, non-irritating environment. You are essentially retraining your bladder to hold more fluid comfortably, allowing for 6 to 7 hours of uninterrupted restorative sleep. Do not fear the water. Learn to master its timing. As doctor, I want you to look at your bed not just as a place of rest, but as a clinical setting for hormonal recalibration. For a man over the age of 60, sleep is the primary regulator of the endocrine system. When you fail to reach deep restorative sleep, your body enters a state of biological stress that directly impacts the health of your prostate. The connection between sleep and the prostate is driven by 2 main hormones, testosterone and cortisol. The vast majority of your daily testosterone production occurs while you are asleep, specifically during the deep REM stages. If your sleep is fragmented because you are waking up every 2 hours to visit the bathroom, your testosterone levels drop. This might sound like a good thing if you worry about prostate growth, but it is actually the opposite. Low testosterone often leads to an imbalance where estrogen becomes more dominant in the male body. This estrogen dominance is a significant, often overlooked driver of prostate enlargement. Furthermore, lack of sleep triggers a chronic elevation of cortisol, the stress hormone. High cortisol levels are pro-inflammatory. They signal the body to hold on to visceral fat and increase systemic inflammation, which irritates the prostate tissue. To break this cycle, habit number 4 focuses on circadian prostate protection. You must establish a sleep environment that minimizes sympathetic nervous system activation. This means the room must be completely dark and maintained at a temperature of 67 degrees F. Darkness is essential for the production of melatonin. While melatonin is famous for sleep, it is also a powerful anechoic agent, meaning it has been shown in clinical studies to inhibit the growth of certain prostate cells. If you are sleeping in a room with light pollution or using a screen before bed, you are suppressing your natural melatonin, thereby removing a layer of protection from your prostate. I also recommend a specific cooling down ritual. Spend the last 30 minutes before bed away from all blue light. Use this time for pelvic floor relaxation or slow, deep nasal breathing. This shifts your body from the high alert fight or flight mode into the rest and repair mode. By protecting your sleep, you are protecting your hormonal balance. You are giving your prostate a break from the inflammatory storms of the day. This is not just about feeling rested, it is about providing the chemical environment necessary for cellular repair and the suppression of abnormal growth. Now we come to habit number 5, a practice that is almost never discussed but is used by urologists worldwide to manage symptoms of an enlarged prostate. We call this the art of complete emptying or double voiding. As doctor, I have seen this one habit reduce nighttime bathroom trips by 50% in just 1 week. The primary problem with an enlarged prostate is that it creates a U-bend or a bottleneck in the urethra. Even when you think you have finished urinating, there is often 2 to 4 ounces of residual urine left in the bladder. This residual urine is a major problem for 2 reasons. First, it means your bladder is never truly empty, so it reaches its capacity again very quickly. Second, stagnant urine becomes a breeding ground for bacteria and can lead to low-grade bladder infections that further inflame the prostate. The technique of double voiding is simple, but requires patience. When you go to the bathroom, do not rush. After you feel that you have finished, remain at the toilet for an additional 60 to 90 seconds. Lean forward slightly. This change in angle shifts the position of the bladder and can help bypass the obstruction caused by the middle lobe of the prostate. Relax your pelvic muscles completely. Do not strain. After this short wait, you will often find that you can pass a significant additional amount of urine. The second void is what clears the bladder and gives you the extra 2 hours of sleep you have been missing. We must also talk about the seated position. While most men in Western cultures stand to urinate, many urologists recommend sitting down, especially for men over 60 with BPH. When you sit, your pelvic and hip muscles are in a more relaxed state, and the bladder can contract more efficiently without having to fight against the tension of your standing leg muscles. Finally, never hold it for too long. If you chronically ignore the urge to urinate, you overstretch the bladder wall. Over time, the bladder muscle, known as the detrusor, becomes weak and floppy, making it even harder to push urine past an enlarged prostate. Habit number 5 is about retraining your relationship with the bathroom. It is about being thorough, being patient, and using the physics of your body to your advantage. By ensuring your bladder is truly empty before you go to bed and throughout the day, you reduce the pressure on the entire system and give the prostate the space it needs to function without irritation. As doctor, I must warn you about the hidden traps that many men over 60 fall into. Often in an attempt to help themselves, they engage in behaviors that act like gasoline on a fire. The first and most common mistake is the supplement overload. I see men taking 10 different prostate support pills they found online. Many of these supplements contain unregulated amounts of saw palmetto or beta-sterol. While these ingredients can be helpful, taking them in excessive unmonitored doses can interfere with your liver's ability to process hormones, potentially leading to an even greater hormonal imbalance. More dangerously, some of these supplements can mask your PSA levels, the blood marker we use to screen for prostate cancer, giving you and your doctor a false sense of security while a serious condition progresses undetected. The second mistake involves hidden pharmacological triggers. Many men do not realize that common over-the-counter medications can paralyze their ability to urinate. Antihistamines used for allergies or nighttime cold medicines often contain ingredients that tighten the smooth muscle at the neck of the bladder and the prostate. If you already have an enlarged prostate, these drugs can turn a slow stream into a complete blockage, leading to an emergency room visit for acute urinary retention. Always read the label for anticholinergic effects if you have BPH. The third mistake is chronic pelvic compression. This goes beyond just sitting too much. It includes activities like long-distance cycling on narrow, hard saddles. This puts direct, intense pressure on the perineum, the area between the scrotum and the anus, where the nerves and blood vessels for the prostate are located. This mechanical trauma leads to inflammation and acute prostatitis, a condition where the prostate is inflamed but no infection is present. If you love cycling, you must use a specialized split saddle or reduce the duration to protect the vascular integrity of your pelvic floor. Finally, we must address the dehydration trap. Many men think that if they drink less, they will have to go less. But as I explained, concentrated urine is a chemical irritant. By chronically underdrinking, you're keeping your bladder in a state of constant chemical burn. This leads to scarring of the bladder wall over time, making it less flexible and further reducing its capacity. These mistakes are often born out of a desire for comfort, but biologically they are a path to disaster. You must stop guessing and start following the physiological rules of your body. As doctor, I want to be very clear. While lifestyle habits are powerful tools for management and prevention, there are moments when the time for home remedies has passed. You must be able to identify the red flags that indicate your prostate health has crossed into a territory of high risk. The first and most urgent red flag is hematia or blood in the urine. Whether it is a bright red color or just a slight pinkish tint, blood is never normal. It can indicate a severe infection, bladder stones, or in the worst case scenario, a malignancy in the prostate or bladder. Even if it happens only once and then disappears, you must seek a urological evaluation immediately. Blood is a signal that the integrity of your urinary tract's lining has been compromised. The second red flag is acute urinary retention. This is a medical emergency. If you feel a desperate, painful urge to urinate, but absolutely nothing comes out, your prostate has completely closed the urethra. This causes the bladder to distend rapidly, which can lead to permanent damage to the bladder muscle and eventually back pressure that causes kidney failure. If you cannot void for more than 6 to 8 hours and are in pain, go to the emergency room. Do not wait for the morning. The third signal is bone pain or unexplained weight loss. If you have prostate issues combined with new persistent pain in your lower back, hips, or pelvis that does not feel like a muscle strain, we must rule out advanced prostate cancer that has spread to the skeletal system. Similarly, if you are losing weight without trying, your body is in a hypermetabolic state, often associated with serious illness. Lastly, pay attention to systemic signs of infection. If you have difficulty urinating and you suddenly develop a fever, chills, or lower back pain, the infection may have moved into your prostate, prostatitis, illy up into your kidneys. This can lead to sepsis if not treated with the correct intravenous antibiotics. Your prostate health is a vital sign of your overall longevity. By knowing these red flags, you are not being a hypochondriac, you are being a responsible guardian of your own life. When these signs appear, professional medical intervention is the only safe path forward. As doctor, I know that knowledge without a plan is just a burden. You now possess a deep understanding of your prostate health, but the transformation happens in the execution. I want you to look at the next 7 days as a clinical reset for your pelvic floor and your hormonal system. We are not going to change everything in 1 hour. We are going to layer these habits so they become your new biological baseline. On day 1 and day 2, we focus exclusively on habit number 1 and habit number 3. Your goal is the metabolic foundation. Start your morning with the Prostate Shield Breakfast. Get your lycopene and your zinc. Simultaneously implement the strategic hydration protocol. Front load your water intake. By the end of day 2, your bladder will already begin to feel less irritated because you are flushing out the acidic toxins and feeding your cells the antioxidants they crave. You might still wake up at night, but the urgency will begin to soften. On day 3 and day 4, we introduce habit number 2 and habit number 5. We are adding the mechanical component. Begin your 20-minute movement routine. Walk with purpose. Feel the blood flow returning to your pelvic region. When you go to the bathroom, practice the art of complete emptying. Spend those extra 90 seconds. Sit down if you have to. By day 4, you are attacking the problem from both the inside and the outside. You are clearing the bottleneck in your urethra and pumping fresh oxygen into the tissue. By day 5, day 6, and day 7, we lock in habit number 4, the hormonal sleep shield. Now that your bladder is less irritated and your digestion is timed correctly, you have the physical capability to sleep longer. Establish your digital sunset. Cool your room to 67 degrees. This is where the magic of deep REM sleep begins to repair your prostate at a cellular level. On day 7, I want you to perform a full system audit. Compare your urgency, your stream strength, and your sleep quality to where you were a week ago. This 7-day plan is designed to bypass decision fatigue. You do not have to wonder what to do next. You simply follow the protocol. Your prostate has been under stress for years, perhaps decades. We cannot reverse everything in a week, but we can stop the progression and begin the retreat of inflammation. This is the start of your second youth. Discipline is the only bridge between the man you are now and the man who sleeps through the night with total peace of mind. We have spent nearly 100 minutes together, and I am incredibly proud of your commitment to your health. As doctor, I want to summarize the core philosophy of what we have built here today. Your prostate health after the age of 60 is a reflection of your systemic inflammation, your hormonal balance, and your mechanical habits. It is not a curse of age. It is a biological response to the environment you provide. Let us recap the 5 pillars of your new defense strategy. Pillar 1, the breakfast. You are now using food as a pharmacological tool, inhibiting the growth, stimulating effects of insulin, and providing the prostate with the lycopene and zinc it needs to stabilize. Pillar 2, movement. You have replaced pelvic congestion with vibrant circulation, ensuring that waste products never settle in your tissues. Pillar 3, strategic hydration. You have mastered the timing of your fluids, protecting your bladder from chemical irritation and ensuring your nights are for rest, not for the bathroom. Pillar 4, hormonal sleep. You have recognized that sleep is the time of repair, and by protecting your melatonin and testosterone cycles, you are naturally suppressing the signals that cause the prostate to enlarge. And Pillar 5, the art of emptying. You are now working with the physics of your body, ensuring that your bladder is fully drained and your kidneys are protected from back pressure. When you combine these 5 habits, you are doing more for your health than any single pill could ever achieve. You are addressing the root causes. You are lowering your vascular age. You are calming your nervous system. The difference between a man who struggles with his health at 70 and a man who thrives at 70 is often found in these small, daily, invisible choices. You now have the power to choose vitality. You have the roadmap to a life without the silent threat of prostate crisis. I want to look you in the eye one last time. I know that dealing with prostate issues can feel lonely and frustrating. It can make you feel like your body is betraying you. But as doctor, I am here to tell you that your body is still a miracle of resilience. It is waiting for you to give it the right signals. Today, you have learned how to send those signals. You are part of a generation of men who are redefining what it means to age. We are no longer accepting decline as the only option. We are using science, discipline, and awareness to maintain our quality of life for as long as possible. But this information only works if it is shared. I want to ask you to do something important. If you found this session valuable, please share it with one man in your life who needs to hear this. It might be a brother, a friend, or a neighbor. You could be the catalyst for their health transformation. I also want to hear from you in the comment section below. Tell me which of these 5 habits is the biggest challenge for you and which one are you committing to starting tomorrow morning. I read your responses and they help me create more content that addresses your specific needs. If you haven't already, subscribe to this channel and join our community of men and women dedicated to proactive health. Click the notification bell so you never miss our deep dive masterclasses. We have so much more to cover, from heart health to brain longevity. Thank you for spending this hour and a half with me. Your time is the most precious thing you own, and the fact that you invested it in your health tells me that you are going to succeed. Start your 7-day reset tonight. Be patient with yourself. Be consistent. I am doctor. Take care of your body. Stay informed, and I will see you in our next session. Sleep well and wake up to a new chapter of your